Hi everyone, Nigel here again from Hand Pain No More. Today I'm going to share with you and show you top 4 hand exercises that you need to do after a carpal tunnel release surgery. This is a standard exercise that all hand therapists will teach you if you have undergone a carpal tunnel release surgery, right? So they are on my right here. There's 4 of them. I'll go through with you one by one, step by step, okay? So the first one's quite easy. It's called fingertip to tip to tip. So basically you start with your, I use this hand, make it easier, right? This way, yeah. No, this hand is actually. So always start with your thumb tip to index fingertip, relax, thumb tip to your middle fingertip, relax, thumb tip to your ring fingertip, and thumb tip to your little fingertip. And then reverse. Again, thumb tip to your little fingertip, thumb tip to your ring fingertip, thumb tip to your middle fingertip, and thumb tip to your index fingertip. This is to keep your joints supple for your fingers because it's going to be swelling. It's going to push your swelling backwards. Make sure you do it in your hand slightly elevated so you let the flow of the fluid backwards, right? So you also keep your tendons for your fingers also quite supple and nice. Exercise number 2 is your wrist flexion extension. This is quite basic exercise. So keep your fingers straight and neutral like this first. So just bend forward and bend backward. Make sure there's no sharp pain, no nerve kind of weird pain. So this just make sure that you can open up the carpal tunnel so that your tendons can glide, your nerve can glide, your nerve can breathe, things like that. This also, when you as you do this exercise, you also allow the scarring that's formed to not stick too much. So you're breaking up the scar adhesions as well, so that it doesn't get in the way of your range of motion for your wrist. Number 3 is median nerve glide. Median nerve glide is median nerve is the main nerve that gets compressed and squeezed and strangled, leading to carpal tunnel, right? So what you want to do is that you want to glide the median nerve, so that it can breathe better. As it breathes, it can restore and heal better, especially after the carpal tunnel release surgery, right? So for median nerve glide, you start with a gentle full fist this way, and then you bring up your fingers this way. Then bring your wrist backwards a little bit comfortably. And then if you can see, you open up your thumb and then you bring your thumb down like a stretch. You're going to feel like a nice little stretch backwards this way. Okay. It should feel a lot of relief for many people. For some people, it just feel like a stretch. Okay. And then repeat one more time. Okay. Gentle this way. Bring it all the way up. Extend your wrist backwards. Turn your hand this way. Bring your thumb down. Every exercise do at least 10 times to form one set, right? So that's exercise number 3. Exercise number 4, it looks a bit more complex because it is. It's called a tendon glide exercise over here. So I show you. So you start with full fist this way, right? Then you become a hook fist. So from full fist to hook fist. From hook fist to lumbricals, which you jut out this way. From lumbricals to extension, and extension to hyperextension. And then you reverse. Hyperextension to extension, extension to lumbricals, lumbricals to hook fist to full fist. This basically causes the tendon to glide. Again, it will also break up any of the scarring that forms, but more importantly, it keeps your tendon really nice and smooth, so you won't get in the way of your range of motion for your wrists and for your fingers, as well as when you do this exercise, it also forms like a muscle pumping action. It brings the fluid away from your injury site, your operation site as well, bringing down swelling. Okay, so remember, it starts with the fingertip to tip, this one, remember, and reverse this way. Wrist flexion extension this way is to open up the carpal tunnel pathway and also to break down the scar adhesions. Median nerve glide is this way. Bring your fingers up, wrist back, open up thumb, stretch your thumb down. Tendon glide, start from full fist to hook fist to lumbricals to extension to hyperextension, and then to reverse. Hyperextension to lumbricals to hook fist to full fist. Each of the exercises over here, do 10 of them, 10, 10, 10, 10, and they all form one set. Do one set in the morning, one set in the afternoon, one set at night. Don't overdo it. You want to do it nice and slow, nice and easy. You just get your healing as fast as possible. So that's all it. Top 4 exercises after carpal tunnel release surgery.